There we go. All right. And let me share my screen again. Okay. So welcome everybody to our family perspectives conversation for Time for Genetics. Our topic today is seizures and genetics, and today is November 28th, 2023. We're excited that you are able to join us today. This next slide, we just have our HRSA funding statement. The work of Mountain States is funded by HRSA. That stands for the Health Resources Service Administration. And if you are interested in more information about our grant, you can reference hrsa.gov. I'm Christy. I'm the projects manager for Mountain States Regional Genetics Network, and I am pleased to be here to be your moderator today and looking forward to introducing you to the families that we have joining us today. So this webinar, or this conversation really, is part of our Time for Genetics initiative. We have Time for Genetics clinics all across our region. We have 28 clinics at this point, with our cohort 1, 2, and 3 clinics. You can see here on the map those clinics denoted in yellow was our 7 cohort 1 clinics, 11 cohort 2 clinics in orange, and 10 of our cohort 3 clinics in blue, for a total of 28. And we are excited to be wrapping up our last topic area, which will begin in December. That topic will be on variants of uncertain significance. And this was picked by our clinics. Clinicians in our clinics said they wanted to learn more about VUSs, as it's known for short. So we will begin that topic area in December. And it is my distinct pleasure to introduce you all to our family guests today. We have Nazar Gozeh from Colorado and Jen Reese from Virginia joining us. Both of them have videos for me to share with you to kind of introduce you to their stories. And then they both are here with us on the call today, and we'll share a little bit more in addition to what their video shows, and then be here for question and answer as well. So with that, I'm going to go ahead and play the video. Give me just a moment to get that slide up and get that started for Nazar's family. All right. Here's the video, and I will start playing this now.
This was the lowest I have been in my life. I have had guns pointed at my head multiple times. I survived IEDs. Nothing compares to seeing my 2 daughters suffering, and I can't fix it.
My name is Nazar.
And I'm Sana.
We have 3 children, Lena, Aza, and Vina. I grew up in northern Iraq in a small town. We resisted the Iraqi regime. We paid a big price for that. 2 of my brothers were affected by chemical bomb. They still have scars. I wish nobody can go through those things. We got evacuated by US government. We settled in Colorado Springs. This became our new home. Sana got pregnant with our first one, and I was overseas, and 2-3 weeks before the date, I received a phone call, and she was at the emergency room, and they had to do emergency C-section, and Lena was born with constant seizures, and doctors tried all kind of medication for her, and nothing helped.
Vina, she had seizure, almost 100 seizures a day.
She was literally arching backwards, back of her head, touching her heel.
The hardest time for me was one night. I called 911 for Vina because she had seizures so bad.
We thought Vina's gonna die.
I was terrified. It's killing my heart.
We went through so many professionals, so many doctors, so many specialists. We were trying to identify what's causing those seizures, what is the diagnosis. And no one was able to give us an answer. No one was able to give us a medication that can stop it. And it was not diagnosed. We were desperate. Somebody recommended the Children's Hospital Colorado And Dr. Scott Demarest was our neurologist at that time.
For many patients with a rare disease, there is a very long diagnostic journey. It takes years for them to be able to find what is the actual cause of their disease.
Dr. Demarest suggested that to keep some DNA sample in the lab with them for genetic testing and research studies. And that became very handy 5 years later.
We were overseas. At the middle of the night, miracle was happened. My husband got the phone call from Children's Hospital, Colorado.
Look at this, Dr. Demarest. He calls us, "Hey, I have good news. The spinal fluid sample that we collected 5 years earlier, there was a new research study. A new gene was discovered, and both of your daughters tested positive for it."
It shows the power of genetic testing. We can discover things that aren't even known yet, and we're going to know about them in the future.
The doctors were able to discover the precise medicine for that specific gene. It was a miracle.
Yes.
It was a miracle.
By knowing what is causing a disease, you can find treatment options that aren't super complicated. In this case, they just needed a vitamin, and we were able to get that from a health food store.
Paradoxal phosphate, which is an active form of vitamin B6. You know, the whole screen of EEG, the doctor was looking at seizures. As soon as vitamin B6 was administered, the screen became blank. No signs of seizures at all.
For Lena and Vina, this meant a significant reduction in their seizures from hundreds a day to almost none. Precision medicine means better outcomes and a higher quality of life.
Everything's changed now. We start all different therapy. They love to learn, and we are super happy about that.
Precision medicine is complicated. It's cutting edge. When you invest in precision medicine, you're investing in the future of all areas of medicine.
It's so important to have this institute up and running. So we started this company, and we are giving back percentage of the profit to Children's Hospital Colorado, to the precision medicine. We want other kids to benefit. There is no better feeling than helping someone who's in need.
We are so thankful for Children's Hospital Colorado. Join us and let's help together.
All right. Thank you so much for letting us show that video, Nazar. Would you like to jump in and elaborate on your family's story? Thank you so much for being here. Oh, you're on mute, Nazar.
Thank you so much for having me here and allowing us to share our story, and hopefully, you know, some families will benefit from it. So it's, you know, it started all with, you know, I was deployed, I was overseas, and Sana had an emergency C-section, and you know, Lena was born, the first one, and she was having seizures. My wife and I, we never seen seizures in the past. We never actually seen anything like it. So it was extremely traumatizing for my wife alone. My wife was new in the country, you know, she was here only for, it's been a year or so. And she was alone in the hospital, and, you know, they took my daughter to NICU, you know, just to be observed, see what's going on. And, you know, they tried all different kind of seizure medications, nothing helped. After a few days, actually after a week almost, you know, the doctor, I was back in town at that time, and one of the neurologists tried vitamin B6, a regular vitamin B6 oral dose, 100 milligrams. That's kind of standard, I guess, in the hospitals. If all the seizure medication didn't work, they try that. And it showed the EEG screen, and it became blank. You know, all the seizure activity is gone after administering that. So doctor was convinced with evidence, you know, that it caused vitamin B6, you know, is the treatment, it's a deficiency of that. So long time ago, there was, I can't remember what year, but vitamin B6 has been known and proven, causes vitamin B6 deficiency, causing seizures. And there was one gene that was discovered a long time ago that was known for it. So obviously, the first thing we did is testing for that specific gene. And I believe that one happened in 2009. It cost a lot of money. I can't remember, maybe $30,000 or so for that specific one gene. And it took 6 months to analyze. There were only 2 labs that was available to us. One was located in California. The other one was located in Netherlands. And the doctors, believed Netherlands was, I guess they had better relation or something, better communication. And so was sent there. After 6 months, we received a note, one line, test was negative. So believe it or not, the specialist who we see in metabolic clinic, the doctor, said, we tested this gene and it's negative. So do not administer B6 to your daughter. Don't give her B6 anymore. At that time, we were giving her regular B6 over-counter 100 milligrams oral dose, I believe 2 times or 3 times a day. I can't remember. 100 milligrams only. And I argued with her. I said, no, we as the parents, we've seen this thing. We know if we don't give her vitamin B6 on time, she will have seizures. And the doctor insisted, literally, we had this verbal argument, between each other, and she got mad at me, for insisting. At the end, she left the room and she said, you could do whatever you want. It's not going to affect anything. And this vitamin is going to be flushed out of her body. I said, fine, we're going to continue. And we continued for years, doing this. Meanwhile, we tried other genetic testing. I believe 30 other known genes that was out there. That was the next step we tested, and nothing showed. And then we did the whole genome for the family, for me, my wife, and the 2 daughters. We end up, with the second daughter as well, having same exact condition. By the way, the second daughter, when she was born, the same neurologist who proved in the first with the first daughter that vitamin B6, their condition is responding. We did it again, but this time we documented even more, with videotaping everything, and we proved it again. Same result. Vitamin B6 stopped seizure that my daughters were having. So we tried, the whole family genome, and the result came back very, very quickly this time, and we did the whole thing. Technology advanced so much during those years. It was just a couple of years in between. And I think what happened was there was so much data that we collected from this, genetic testing. The doctors were puzzled. There was no one that can decode, understand this. They compare it to what's known in the past, a few genes that's known that's causing certain things. And, they were looking at numbers and then hoping, they find something that's odd. They were unsuccessful. They had no clue. The people who looked at those data, it was just raw data, with no knowledge to compare with. So it was missed. They didn't know until a research study in London. They came up with it, and they identified a new gene, the known gene, and then they tested my daughters. Both of them came positive for that specific gene, and that specific gene is called Prozac, PROSC, and then PLPBP gene. That's known for causing this. And the way they described it to me is, when you take a vitamin B6, it goes to the body and then it changes to paradoxal phosphate, and then from there it goes to the brain, to those neurons that helps between that make that communication. So the after the genetic testing, we had a still remember that day, we had a meeting where genetic specialists, doctors, metabolic doctors, expert. Those were super, super smart people. I'm sitting, I'm excited. I'm so happy to listen to them. I write everything, I videotape, the whole conversation. So they recommended to give active form of vitamin B6, which is pyridoxal phosphate. Normally, body will change that, but they bypass that and give an active form. And then we experimented with the dosage. We started with 100 milligrams 3 times a day. Then we increased it. Currently, they are on a very high dose, 400 milligrams in the morning, 300 milligrams at noon, and then 400 milligrams in the evening. So the total dose it has to be no lower than 17 milligrams per kilo of the body weight. And if we keep it below that, then they will trigger seizures. If we keep it above that level, currently they are on 19, I believe, 19 milligrams per kilogram of body weight, and it's stable. They are stable, not having seizures. So we experimented with this, and then, soon enough, with a few months, they were seizure-free, unless they don't absorb, they don't swallow the pill that we give them, which happened a couple times, or they vomit, after that, it doesn't get absorbed, or they grow, and, that body weight, that threshold will change. So our experience, with our journey with different doctors is just very bumpy, I guess I would say, but very rewarding at the end. We've seen amazing doctors. At birth, we had a family care for my daughter, and she was the PCP. She was extremely helpful, taking extra care, because she knew, the difficulties as a parents, we because of those seizures, 100 seizures a day, and between 2 of them, is just extreme. My wife and I were like zombies. We couldn't sleep at all. There is no way. My brain is so damaged from this, a small sound, I'm right awake and I cannot go back to sleep. Even now, I think if I get 5 hours a night, I'm extremely happy. But that doctor was helpful to understand us, getting us on time, not having us to wait, at the a lot of doctors, when they schedule, because the office schedule, people go and wait half an hour, an hour sometime, before you had a chance to get in. And that was for 2 autistic daughters, and there were no daycares that will accept our daughters. We didn't have any support. We couldn't leave them alone. We couldn't even, my wife couldn't drive alone, because if she gets seizures in the car, it was extremely challenging. So that helps a lot, getting the patients in. And then there is another issue that we noticed, and we traveled overseas, looking for treatment, cures. So we've seen many doctors. A simple viral, cold symptom, they get sneezy nose, whatever, that can trigger, can cause, turn into a serious infection in their case, because, they don't know how to cough it out and how to spit it out, how to clean, be sanitized, a simple cold, the drool in their lungs, and then soon that will turn into a serious infection. Sometime, even if antibiotics was not required, we knew it was a virus, causing this. But, we had a couple of doctors that said, what, in your case, you do need antibiotics for this. And, that prevents it from other issues. It was a very, very difficult journey. I think currently, we are more stable. One of the daughters still is not potty trained. She's 12 years old. I was feeling so bad for my wife. A normal mom will change diaper, a year, maybe a few weeks, a few months. I mean, my wife been changing diapers for 27 years now. It's just adding all those kids together is just extremely difficult. But we are blessed. We are blessed with a genetic result, a simple vitamin that we find online. It's cost $16 a jar. We run through every 2-3 days. We run through a jar. I just spent $2,000, ordered 6 months supply, and I have it in a basement. They question me. They say, "Why are you buying all this stuff? What are you doing with it?" I say, "I'm not smoking it." But we are blessed, and I'm open for any questions.
Thank you so much, Nazar. I appreciate that. Does anyone have any questions specifically? If not, we can hold them till the end and I can share Jen's information and then we can do the questions at the end. But I just want to pause for a second if anybody has a specific question. All right, we'll save the questions till the end for you, Nazar, if that's okay. And I'll go ahead and switch gears. Thank you so much for elaborating on your story and sharing, letting us share the video as well. And Jen has a video as well. I just saw that she dropped off our call, so hopefully she'll be able to call back in. Oh, there she comes. I'm gonna go ahead and share screen and play Jen's video. Jen is joining us from Virginia, which is outside of our Mountain States region, but I know Jen through our Genetic Navigator program, and she's a genetic navigator in Virginia. So let me go ahead and share screen and play Jen's video, and then we'll have her chime in. She's in the car just returning from an appointment for her daughter. So we'll see if she's in a place where she can talk after this video. All right, let me go ahead and share screen and give me just a second here to bring that up again. Let's see. Just have to get to our other, there we go. Okay. And here comes Jen's video.
9-year-old resident of Virginia. I'm married and I have 2 daughters. When my oldest daughter, Kaylin, was born 15 and a half years ago, she made me a mama and in turn made me an advocate, chasing a diagnosis and help for the horrible seizures that racked my tiny baby's body every day, many times a day, and we would later realize tortured her in utero as well. At 5 days old, she was hospitalized for the first time on the neurology floor at Children's Hospital in DC. We knew something was right and had been prompted by our pediatrician to take her there. We were in the ER waiting to check in when a nurse saw the weird flapping and contorted body movements she was making and ripped her from my arms and took her directly to the back. That's when shit got real, and it was a pivotal moment in my life, never to be forgotten. Her tiny 7-pound body was poked and prodded. She had many vials of blood taken, a spinal tap, and then she was admitted and hooked up to her first EEG. At that time, we were sent home with phenobarbital, an antiquated medication created in the 1950s, whose job was just to sedate and make my baby sleep all too much and have a difficult time nursing and drinking from a bottle. We were told many times seizures resolve in infants within 6 months. That was not true, and at 6 months old, Kaylin developed infantile spasms, West syndrome, and we found those seizures did irreparable brain damage. My daughter's suck and swallow were affected. Her ability to smile and be present were forever changed. She is nonverbal, non-mobile, and sadly I describe her as an infant in a 15-year-old's body. She's unable to express pain, sadness, illness, happiness, anger, and joy. She's developed mobility issues and has been diagnosed with cerebral palsy and spastic quadriplegia. She's 100 pounds, and the only reason I can pick her up and transfer her is because I never stop picking her up. I'm not a physically fit person, and I'm just 3 inches taller than her, but I pick her up and transfer her from her wheelchair to her bed and vice versa. At times, it feels like we're just tigers chasing our own tails. We give her medication to lessen the seizures, and then those medicines sedate her and have caused her to not be able to assist in any activities for daily living. Eating is via spoon fed like an infant or feeding tube directly into her belly. Due to the cerebral palsy and being non-mobile, there have been concerns for hip dysplasia, low bone density, and before the age of 10, she was diagnosed with osteoporosis and osteopenia. She's developed a 49-degree curve in her back due to scoliosis and positioning that must be watched to see how it's affecting her lung capacity and definitely causes her illness to progress to pneumonia at a much higher rate. Full spinal fusion has been discussed but not decided upon yet. She's currently on 3 seizure medications, which are her best cocktail to date for controlling her seizures: Onfi, Banzel, and the prescription CBD oil Epidiolex. She's also on medicine for reflux, allergies, multivitamins, vitamin D, probiotics. She gets regular enemas and suppositories, which are necessary for any bowel movement, breathing treatments with nebulizers, inhalers, including multiple pieces of equipment which are added into the mix when she's sick, including a cough assist, a cough vest, a suction machine, and supplemental oxygen at home. We have to watch for bed sores and are always on high alert. Hypotonia or low muscle tone is another crappy side effect from what's happened to her brain and her body. For this affects mobility and grip, but also her intestines and diaphragm. These are all muscles, and low muscle tone in the intestines causes constipation to be her regular. She has a CPAP for sleep apnea, and I was told the diaphragm is a muscle, and since hers is so weak, the air isn't pushed out hard enough even to make a snoring sound in most cases. The fear, the anxiety, the smiling through tears, the prayers that this time your baby won't die, and hope that you won't go in one morning to find she has passed away in her sleep due to seizures and the evils that is SUDEP, sudden unexplained death due to epilepsy. Short of a complete cure, an ideal treatment for STX-BP1 would be an easier life for my daughter, less medical issues and complications, and aiding her cognitive ability, communication skills, and overall body function in regard to mobility. Less living on the edge of anxiety and rushing off to the emergency room when she develops pneumonia or is just non-responsive and won't wake up at school. Over the past year, we've had 3 of these instances with ambulance rides, trips to the ER, 12-day inpatient stays in the ICU, breathing tubes, feeding tubes, and it just sucks. My friends with kids her age are starting to drive and looking for colleges and what wonderful futures they have before them. I've come to the realization I will never be an empty nester, and my biggest hope is that my daughter dies before I do, so I don't have to worry about who will take care of her when I'm gone.
Oh, I see Jen on camera. Thank you, Jen, for being here today. I know you guys are coming back from an appointment. I see your daughter behind you. Thank you for letting us share that video. And I'll just note that maybe you can fill in a little bit of the details. That was recorded for a recent FDA meeting and played at the FDA for a parent meeting for the STXB1 condition, correct? Oh, you're on. Oh, hang on. I might have muted you. Hang on. Let me see if I can. Let's try it one more time.
Now can you hear me?
Yep, go ahead.
Okay, good. So yeah, so the meeting was, we have a foundation for her diagnosis, the STX-BP1 Disorders Foundation, and they set up a meeting with the FDA, and the FDA does this with certain rare diseases to find out more and understand how they really affect the individual and families. And so there were researchers, people from the FDA, neuroscientists, all there to learn from families what it's really like to have this disorder. And her disorder is de novo, so it's not inherited. It's just some random thing that happened. And we were told that there was less than 1% chance that any other kids we had would have the same diagnosis. And so I actually was pregnant with her younger sister when we found that out. So, so that was just an interesting piece. And before, she didn't get diagnosed until she was 4. And up until then, they had done lots of genetic testing. At the time, from 2008 to 2011, it really wasn't common to do like whole exome, whole genome. And so they would test like one thing at a time and they'd be like, nope, that's not it. And so I would always say, well, science has to catch up to Kaylin. And so then she got diagnosed, when she got diagnosed in 2011, there was just the chemistry drawing of your brain. And that was it on in terms of the internet. And so I created the first Facebook page for our group, and now there's people worldwide, Australia, lots in Europe, US. And so we've been able to connect. And nowadays we we just never knew what the lifespan would be for this diagnosis. And so now kids are getting diagnosed at just a few weeks old. They'll be born and develop seizures in the hospital, and then the they'll just decide to do the whole exome, and so they find out 3 weeks old sometimes what their kid has, which is good and bad. I mean, it's good because then they can join the Facebook groups, but then you see what life might really be like. And so there's a big spectrum for her diagnosis, and like it can range. There are some kids that just present with a pretty severe autism. Some can walk, some can feed themselves, some even have some words. She's definitely on the more affected end because of the West syndrome and the infantile spasms and the damage that did. She's really, just the higher end of care necessary. And so it's been an interesting journey, but we found other families, and I think there's probably way more kids with autism that have this diagnosis than people are doing genetic testing on, because it just is amazing to me how many new people get diagnosed. And some of the kids don't have seizures, which when she got her diagnosis, we were told that intellectual disability and intractable seizures were like the two things associated with this diagnosis. And we already knew that before she got diagnosed. And since it's something in her genes, we were like, okay, well, it's not anything you can fix, and it doesn't change anything for us because it's the same, it's the same outcome. So, but we have found, I think the oldest person in the group is in their 40s. So we have found that there is a big range, and some of them can lead a long life. We've had a lot pass away over the past couple of years, especially COVID. Respiratory is definitely a big issue for them. And respiratory and SUDEP seem to be the two biggest that take our kids. At the FDA meeting, there were a lot of parents who spoke and videos they recorded and a big, like parent panel. And all of a sudden, all these people were just focusing on, oh, I wish my kid could talk and tell me what was wrong. And they were going on and on. In the meantime, in the Facebook groups, all the parents with the more medically fragile kids like mine were like, yeah, I don't care if she talks. I just don't want her to die. So I was able to dial in, and I was the last speaker to give comment. And I said, look, we need to take it back a step. Like, yes, it would be great if Kaylin could talk. I've always told her that if her first word is a 4-letter word, I am a-okay with that. But I just need them to stop dying. Like, I need you to figure out how to make the seizure stop so there isn't the brain damage. And, and these kiddos aren't passing away from things that a typical kiddo could fight off and be okay with. I'm trying to think what else. Anything else you want me to share, Christy?
Oh, I think that's great. Anything else that you have maybe advice, like Nazar shared, of just your interaction with medical professionals over the years? Any advice for pediatricians that since that's our audience here today is mostly
Sure.
primary care? Anything you want to add about that?
Sure. There's actually 2 clinics now that focus specifically on her STXBP1 diagnosis, which is a syntax binding protein in the brain that doesn't work right. But there's a clinic at Children's Hospital of Philadelphia and actually one at Children's Hospital Colorado. And so there are lots of families that go to those because then you see all the specialists in one area. And I mean, we're always chasing the seizures and trying to figure out medicines. And so that's always been an issue. And some kids do, like my daughter does really well on her 3 medicines. Knock on wood, it's been probably 4 years since she's had bad seizures. But there are some kids on the same medicine as her that they just can't handle. They can't do those medicines. And so we actually have a really great partnership with our pediatrician. The first one, who didn't send us in an ambulance to the hospital, told us to just go head on down. And we stopped at home and had lunch and packed bags, and not realizing that this was an urgent thing and she should have been helicoptered to the hospital. So he got fired at about 9. When she was about 9 months old, I was just done. And so now our pediatrician, we've been since she was 2, and she is phenomenal. She actually has a nephew who was born with some cardiac issues. So it seems like that really the more medically fragile kiddos are really her realm. So in the practice, if I call and say, oh, she's one of Dr. Carroll's patients, like they know she needs to get in right away. Like it's not like, you know, a typical cough. And one of the things too was when her little sister was born, you know, and she'd have a cough or she'd have a snotty nose, and I'd go running to the pediatrician, and they would look at me. You know, if I didn't see the doctors who knew her older sister, who knew my first daughter, they would look at me like, this lady is, you know, complaining about a cough. And it's like, no, no, no. I need to know if that is flu or what she's got, so I know if I need to keep her away from her sister. So, you know, and if her sister needs to go into quarantine, and really how serious is this? Is it just a sniffly nose, or is it really something that if Kaylin gets, it's going to end up a hospital stay? So we try to stick with the ones at the practice. Well, we're in a practice of probably about 12 pediatricians, and we try to stick with the ones who know my older daughter's history. So when I come in, they don't look at me like I don't know what I'm talking about. But we have a really great relationship with our pediatrician. And not that I expect all of you to do this, but we have her cell phone number. We text. When Kaylin's in the hospital, she's actually watching on the electronic records what they're doing while she's in the hospital. And we check back in with each other. In January, she was in for an aspiration pneumonia, and the pediatrician, they wanted to do some tests. And so our pediatrician saw, she's like, look, they want to do another chest x-ray, but they also want to do a CT of her abdomen in a couple of weeks. So why don't you just ask them to do both at the same time, since you're already inpatient? And so the pulmonologist was like, oh yeah, that's a good idea. So it's just great to have her as like this extra person who really cares about my daughter, and the other kids like her. And, you know, we definitely have a special place in her heart. And when Kaylin turned 15 in February, I actually texted the pediatrician and I was like, okay, she's 15. Please don't tell me that we can't see you anymore in 3 years, because that's just not enough. So she's agreed to keep on our kiddos, especially because they stay in school longer till 21, 22. And so I have, I don't know what, like 6 or 7 years to convince her to switch over to a family practice rather than just a pediatric practice, so we can keep her. So, you know, she's just been a godsend.
Thanks for sharing that, Jen. And I do see we have a couple of our clinicians have joined us. So with the last 10 or 15 minutes here, I'm hoping maybe they have some questions. If not, I have some questions that I might be able to ask. I do see that there is a comment in the chat, so I'll just read that out. Amanda says, thank you so much, Nazar, for your insight. I've seen your daughter's story before, and you guys are amazing advocates for them. So not to put Amanda or Nicole on the spot, but any questions that you all would like to ask Jen or Nazar today?
No, I don't think so. They're kind of covered everything.
Great. Thanks, Nicole. How about you, Amanda? Oh, she doesn't have a camera on her computer. Okay, well, you can type it in the chat if you have any questions there. I just have a question for both of you. You've kind of touched on it already. And since we are recording today, and this will be in our Time for Genetics archive, would you mind commenting, maybe both of you separately, about kind of those early days? And I know both of your stories, you talked about the seizure starting immediately. So maybe from a primary care provider perspective, what did you need in those early days, as far as support, as far as understanding what was going on? Jen, you referred to like the urgency of things. Nazar, I know you talked about, you know, the trial of the B6, even just in the hospital and before your daughter went home. But can you talk about a little bit from that primary care pediatrician role of those early days, especially with it both being your first child in both of your situations?
Sure, I could go first. So we actually did do that B6 thing the first time she was in the hospital. They were like, oh, let's just try this and see if it works. It didn't for her. But they also told us, you know, in the hospital that, oh, seizures usually resolve with kids within 6 months. And that just didn't happen. But early on, the pediatrician we had, like, he had been my primary care doctor, and I really trusted him and, you know, his experience. And I don't know if he just hadn't seen babies having seizures or what. We we went a different route that a lot of people did because, you know, like a lot of these kids, they'll see them having seizures when you're first born in the hospital. But for us, we were in a birthing in, so she didn't go to the nursery. She stayed with us. She was wrapped up in that blanket the whole time, like a little burrito. So we didn't see the weird arm movements and shaking stuff. And really, our biggest issue at the beginning was she just wouldn't wake up to eat. And it was a post-ictal state that we didn't know that's why. And I even had one lactation consultant come in and was like, listen, we've been over this 3 times. If you can't get her to nurse, you're going to have to switch to a bottle. So we went to the pediatrician, and it took my mom coming with us and saying, no, what this is going on with this baby is not normal. Like, and our pediatrician was just kind of like, oh, well, sometimes babies make jerky motions. So, you know, I understand that there are a lot of parents who go on Dr. Google and then just get all confused and think it's the end of the world. But really, sometimes it is. Like, I know the whole saying is if you hear hoofbeats, think horses, not zebras. Well, my kid is a zebra through and through. And we celebrate Rare Disease Day with the, with the zebras all the time. So every year. So, you know, really, I get it that it's rare that this is what's going to happen. And, but you're going to have to think out of the box, because there's just sometimes where I'm not just a crazy mom, like there's really some stuff going on. And for her diagnosis, the STXBP1, it's the 5th leading diagnosis of genetic epilepsies at this point. So it's that common. And I really think there are way more people who have it who just have not been identified. Because in the beginning too, like when we started the Facebook group, all the families who were on it, all their kids were white. And I was like, okay, so is this like a European genetic diagnosis? Like, is that where, you know, what line of, you know, the family it goes through? And then really now it's every skin tone, every country, all over the world. And I think at first it was that we were the ones who had access to good testing, good medical, and all that stuff. And so now it's been, you know, more and more have been added to it. But I think that's really, you know, where it's gone so far.
Thanks for sharing that, Jen. And do you mind to just comment on the Facebook group a little bit? I know you said you started it, and we have so many families that we work with Mountain States who have found their groups, right? Their disease, their gene specific named groups through Facebook. So do you want to just comment on that while you're on the topic about how that started and now how many it's grown to?
Sure. So it's interesting, and you know how parents have different takes on things. So I started the group. There's probably about 500 members in the group that I started now. No, actually we're up to like 850. But a couple of years ago, there was this big like schism, this big civil war amongst the families, because some of them did not want to focus on medical. We don't want to focus on doctors. We don't want doctors and other people who care for our children in the group. And so it kind of broke off, and there's like another whole subgroup. And it was just really odd because they didn't want no sharing any research, none of this stuff. So it was like, okay, I understand you want to be there for the personal supports, but you know, like people need to know. And it is scary because we do share on there, and every once in a while we'll have like the candles and the vigils for the kids who have passed away. And if you got a brand new diagnosis, you know, now you're worried even more. And, you know, I talked to a lot of parents, especially ones who are recently diagnosed. And I was like this too, like we just chase that medicine and hope that the next medicine is going to make my kid normal. And so I get very frustrated, especially because this is a genetic thing, and it's not going to be fixed anytime soon. It's not going to, even if you come up with a cure, it's not going to fix the brain damage that's happened for her. So I try not to take the hope away from those new families, but really, you know, like we lucked out in finding her 3-drug cocktail that really works now. But, you know, I don't want to take away that hope, but I also don't want them to get a scary sense of, you know, if we get the right medicine, my kid will be normal. And, you know, normal isn't necessarily going to happen.
Thanks for
and
that.
My normal is way different than other people's normals.
Yeah, you have your own personal definition. Yeah. Nazar, would you like to answer the question that I had earlier about the early support and things that you needed from you mentioned about primary care providers getting you in, in a short amount of time, not having to wait. But is there any other early day support that you can think back to that your primary care provider was able to provide your family?
Yeah, sure. Jen, thank you so much for sharing. This is inspiring, all the things that you talked about. I would love to get in touch with you and learn, a few things that you did to support, your daughter. So at the early stage, my daughters both, we started with Lena first, right? And so she was having seizures, and we knew it was seizures, but we didn't know why it's causing seizures. We tried so many different medications, so it worked for a month, and then, after a month, then it doesn't work. Then you try other stuff, they prescribed, Diastat, an injection, rectal injection, to try to stop seizures. I think we used those more than anything else in the world. The whole trash can get full with it. What a few things that help, of course, in addition to the seizures. My daughters were having autism, low tone. I understand, Jen, all the stuff that you mentioned. We went through all those stuff. One thing, it still shocks me, when we had a first meeting with a neurologist. Well, not first, but when we had a meeting with a neurologist, and he was, poor guy, he was puzzled, how to stop seizures. He closed the door, and behind the door in the office, there were a list of seizure medications, tons of them, 15, 20 different kinds. And he said, well, it's time to try something else. What do you think? Which one you want to try? He asked my opinion, which one to try from the list. And that was so shocking. I looked at my wife. I said, what the hell is going on? I mean, what do you expect me? And we were looking, are you crazy? Are you out of your mind? Well, you ask some follow-up basic questions. Well, which one is better? Which one's less side effect? All the same, you should try. And, the pediatrician that worked with us was extremely helpful. She knew our condition, and she was helpful, in many ways, helping us. However, I wish she recommended, or she tried a little bit more like supports. We had no clue. My wife and I were just alone in this. It was just nights of seizures, and we were desperate. We had no clue what seizures are. It's just, is she dead? Is she dead? Is she alive? And then she breathes, okay, she's alive. One thing, I think it helped quite a bit with us. Every time, of course, they were, prone to many, other health issues. A simple cold, will trigger fever, will trigger seizures. And one thing, medication that helped us quite a bit was Zofran, it just prevent from vomiting. And I don't understand why doctors at that time were prescribing just a few pills at a time. It saved our lives so many days, so many times. But I insist, I don't know, maybe there is a side effect or something. But we just visited another one for my daughter because she's vomiting and she has diarrhea. And this doctor prescribed, tons of it, enough for my other daughter as well, because we know she will get it. And now we have enough, because as soon as they vomit, that medication doesn't get absorbed, and that causes seizures and some other stuff. But at that time, when my daughter was sick, they prescribed 2 pills, 3 pills only. I don't know why. That might be something to review and help other families.
Thank you so much for pointing that out. Go ahead, Jen.
I have one more. So another extreme pet peeve for me is a lot of these kids with low muscle tone have constipation issues. Like, that's her normal. And everybody just throws Miralax at it. And then when she was like 4, I read all these horrible articles about Miralax and all the stuff that's in it and how it's so bad. And at 4 years old, she was on 2 adult doses of Miralax a day, and it still wasn't working. And I took her off of it, and the seizures got better. And then also for her, she has food allergies. So she has severe milk and egg allergies. So when she would get any touches of that, forget it. It would be seizures, vomiting for many hours, and then seizures for many hours after that. So, just those random things that you don't think are going to be such a big deal really affect our kids so much more.
Great point. Thank you for pointing that out, Jen. And sometimes it's hard to think that seizures are the focus or the genetic condition is the focus. And I've heard from other families, like sometimes you have to realize there are other things that can be going on with our children as well, right? That sometimes we have to think that there can be more than one diagnosis, like you're saying, the allergies plus the constipation plus the seizures. I have a question in the chat here from Amanda. So she said, did the assurance of most kids grow out of it help at the time that assurance was given? And I think it was you, Jen, that maybe mentioned that in your story. So do you want to speak to that?
I mean, it was kind of like oh, all right, well, that's good. But then as things went on and it just got worse and worse. I mean, we started out at Children's National in DC, and we really liked the neurologist we had from there. But at one point he was like, okay, well, tell my secretary you need an emergency appointment. And a week later we still weren't in. So we ended up going to Johns Hopkins in Baltimore for a second opinion. And it just made such a big difference. So like for 10 years we would go to Baltimore to see her neurologist, and just had a much better understanding of what to expect and where we were. And like every once in a while we would do all the physical therapies and occupational therapies, and like, okay, one of these days she's gonna walk. And it just got to the point where we were like, no, she's not gonna walk. Like, she can't sit up. She can roll over somewhat, but she can't sit up. Like, she's not gonna walk, and I'm not going to invest all my energy and all my expectations in that and get let down. Like, my husband and I both kind of attack it with like a sense of reality. Like, yes, we're hopeful, but I'm not going to go chasing something that then I'm just going to have huge letdown about. Like, yes, it would be great if she could walk. Yes, it would be great if she could talk. A 4-letter word being her first word, okay with me. But that's just not where it is. And we I go more for her comfort and for what's works with our family. We've been lucky in that both my husband and I work from home. So if she's ever sick, like, she's home with us. And COVID, she sat next to me doing school, and I sat on Zooms, and people would be like, hey, Kaylin, every time we had the meeting, because she's sitting right next to me. So, like, I've been lucky and fortunate in that instance where, we've had those supports. And in Virginia, she was able to get Virginia Medicaid at a year old, and that's been like a lifesaver. And I tell people, like, we just wouldn't have had another kid, and we would not own a house if we didn't have Medicaid, because it just relieves so much financial stress. It helped with copays, it helped with therapy, it helps pay for medicine, equipment, especially. Her first wheelchair was more than my first car. So, it's just that extra help has just been such a great thing. We could never move out of Virginia, but that's fine. So
thanks for that perspective, Jen. And I see in the chat that Nazar, you answered that question there too. It helped your wife to have some hope with being told that. So thank you for that.
It did. My wife was thinking, like 20 years ahead. Is my daughter going to get married? Is my daughter going to have kids? I mean, I said, let's take it, 1 hour at a time, one day at a time. For me, it didn't help. I needed to know exactly what's going on. And at early days, I actually rolled the sleeve and I started reading, and I read so much. I became lost.
Sorry, Nazar, I accidentally muted you. Can you unmute yourself? Sorry, go ahead.
I studied a lot, but I got lost, and I learned it's better to be a caregiver than become a specialist in something that we don't know what it is. So it was best, I changed, and I tried to find, better people who knows, what they need, what they're doing.
Yeah, and we've it is hard, I get in good times and bad times, like the fact that the kids who were born the same time as her that I met in the first moms group I was in, they're getting their driver's license. They're starting to think about college, and that's just not going to be a thing for us. So, like, I go along and I'm all right, and then I don't have such good days. And then part of my work, I work at the Center for Family Involvement, helping other families, and I'm providing emotional support for other families, but there's some times where I'm just like, I'm not emotionally in a good place myself. How am I supposed to help other people? So, it is always like we just kind of go with it and we get through what needs to get done. And if she's sick, those are hard times, but I can't get bogged down in all the coulda, woulda, shouldas. And I've talked to too many parents who just get caught up in all that. There's one mom I know whose child had a birth injury. The cord was wrapped around his neck when he was born, and so he has brain damage. And she's so angry. And he's like 5 years older than my daughter. And it's like, I can't live like that. We got enough stuff going on that I can't focus on that. And, it's just not a way to live.
Great perspective, Jen. And you're right. Sometimes we have to fill up our own emotional bucket, right, to be able to help other families. So thank you for the work that you do. And Nazar, thank you for sharing your story. I know you guys are ambassadors in Colorado for Colorado Children's Hospital and helping other families by sharing your story as well. We've just come to the top of the hour, so I want to be respectful of everyone's time. I just want to read one comment here. Amanda had to run, but she said, I'm massively appreciative both of your perspectives as I continue my practice, and will keep your stories in mind. So thank you for sharing today. We are recording this, and so our other clinics who are in clinic today can watch the recording and take your words to heart in their own practices all across the Mountain States region. But I just want to thank you both from myself and Mountain States Regional Genetics Network for your time today and for sharing your stories. I really appreciate you both.
Thanks
Thank
so
you.
much.
All right. Thanks, everyone. Have a good week. Bye-bye.
Thank you. Bye-bye.
Bye-bye.